Hello, listeners. This is Yukta speaking, your host for today's episode, which is the talk given by Dr. L. Gopi Chandran. This talk is a part of the first virtual IC Nursing Innovator Forum meeting hosted on the topic Nursing Practice Trends and Innovation. Let us hear from Dr. L. Gopi Chandran.
Very good afternoon to everyone. So I'd like to thank Chairman and all the panelists, chief guests, nursing student, faculty over here. So very good afternoon to everyone once again. First of all, I thanks to for the invitation and sharing my thought on it. Actually, I was really impressed with the speaker, last two speakers. They were really highlighted about that. How that especially for now we prepare the nursing student to go into the today what challenges they are going to face and how they overcome to prepare as a as a quality nurse and empowered nurse what we expected. That really I think they are the today from their talk they have to take into the different way how we expected from this outcome of this forum. So we cannot forget our lady with the lamp. She is our pioneer, and also today we are this forum was majorly focused on the innovations and how we being a nurse, how we be the better innovators, and which we are able to improve the patient care outcome. And also definitely the nurses today globally they emerging or emerged as a different role as a clinical nurse, nurse specialist, or administrator, educator, researcher, whatever it is. Exactly, they were nurse need to be, as a nurse, to be very compassionate. That's what our the quality which can be compared with the doctors. We will never compare with them because we are our unique professions which project to them how we are, how that we are able to accept or recognized by the community. So the same way, she as a compassionate nurse who we in today everyone either not only as even doctor, still they used to remember Nightingale because of her compassion. She is not only compassionate, she is the first scientist and is a statistician. Is that still we have to be proud of that because today nurses can innovate, nurses are can able to do innovations, or they are able to do innovation, or they may be the scientists. Still there is a query, there is a question, still we are not able to reach some status over in India as compared to other country, but still she already proven almost 100 years before her era between 18 to 20, 1910. At time itself she all called or emerged or maybe proved as a nurse scientist, because the reason is she always to say that she always believed that nursing has the responsibility to promote the health of anyone, any human. That's what their concept. That's why she proved as a nurse scientist. And again, it's come to that today, 2020. You can see these two, situation context. In medical community, they are innovated, or maybe they done, they contributed to the society by world first living, donor. Lung transplantation during the time of COVID-19. It's happened in Japan. Everyone, the eyes are open, and all people are talked about it. It can be possible. It's happened after a long time. During the COVID, we know that the lung was everyone they were working on how to get back from after the the effect impact of the COVID-19. But same thing happened in another place in Brazil. The nurses they also made the innovations. They just simple. It's very without spending any money, without the cost. They used two gloves filled with the warm water. They put together, and they were satisfied the patients. The patient also satisfied. They feel like someone holding his hand. They named that as a God's hand, and they were clinically also they improved the show the outcome. The patient perfusion and saturation was improved. That's they didn't spend any money. They are just use the material with this. That is what nurse that we call it with that with our compassion. We understood that patient is the whole. It's a holistic manner. We are, even though we work on to whatever the previous speaker mentioned, that have different role as a specialist to monitor the parameter, report to the doctor, administer medication, still as a curative, but still we expected that we supposed to all the time look into the patient as a whole, that understood such something ignored the patient. Even though the patient is survived, even though patient symptoms is reduced, something need to be, something is ignored that I have to overcome as a nurse. That's what had done it without any resources. That is the innovation today nurses are doing in 2000. That was in same innovation, same kind of compassion showed by the Nightingale 100 years. Today, the same nurses, our nurses community, following, with the manner which they projected. That also today open our eyes that nurses always innovated. So, but same way, another end also nurses are criticized that same kind of repetition doing in thesis and dissertation, some kind of study replicated. That also putting that down that they all the time means invent the same. That means invent the same thing whichever we are. Testing the same hypothesis many times, which already proven. That also we are happening in one end from nursing community. That also criticize how nurses, why nurses not is a good innovator, means why nurses are not proving it's a scientific manner. So that's why we always expected that don't reinvent the wheel. That is our concept. That's why nurses today somewhere else accepted, recognized with their compassion. Another way, sometimes the quality of the work which is showed that need to be enhanced to prove, and that how we scientifically we are professional. This is what nursing today between still we are since from Nightingale to today, how nurses continue and what we expected in the society to be the innovator or the nurse scientist. That is what the talk today from my side with my own experience. So here you can understand again COVID, bring to the COVID, because COVID, we cannot forget it. COVID taught us a lot, made us to understand, and again to bring it post-COVID to use or to lead on the life in a different manner. That is one of the most important things is technology. There is no doubt about it. The technology, adapting the technology by nurses, it is now easy, because earlier I was worked in in different platform, different area, even in Gulf country in AIIMS. Nurses used to resistant on that. I cannot use the laptop, I cannot use the computer for entering the patient data. Now they are adjusted, adapted, because earlier very difficult to use the mobile phone. Now all mobile phone with different manner, where the same function which is happening in everywhere in other sources also. That's why the technological adaptation is good enough for nurses, not only any general public nurses. There is no doubt about it, because during the COVID, we were all forced to adapt this technology. It's better than earlier. That's what the truth. That is no doubt about it. That same which was we are showing that by it's accessing the healthcare, or maybe getting your food, or maybe the education, exactly, that even we were think that how we can able to complete a course of the student, but we are used to different forum to help us to complete that all theoretical part. Even we are not able to do the clinical side, but still we were able to clinical part. And even though we stimulate the student with the different sources of the by clinical situations, to make them to understand the concept of how you have to react, how to respond, and the kind of simulation learning also we made through the digital sources. So digital is the one now. It's always now with along with our life. And it is not only for our promoting the health or preventing, or whatever we are used for prevention of the health, and the education also, in especially nursing education also, we are very well utilizing nowadays. So many countries, including this today forum, we are using the digital mode to complete and inspire and also motivate the nurses to learn many things. That is no doubt about that. We are extending and going to the different level. But same time, we are utilizing for that. This is what today the concept, utilizing the digital, the health for the patient, especially for prevention of the disease, promoting the disease. That is need of the hour. That should be understood by the nurses, understood by the public, understood by the medical community. That should be most important. That's bring the outcome that we maybe missed out many things before. Now that is helping us to overcome many health issues, and also to preventing most of the diseases by getting the many data, and that able to follow up the patient, that improve the patient's outcome, and in many outcome like decreased mortality, decreased morbidities, improve the quality of life of the patient, reduce the admission rate and reduce the readmission rate. Again, it is increasing the drug compliance. That's all many outcomes today improve because of the kind of the digital health or digital technology that really help the patient to come out nicely. Otherwise, and also the patient experience, even the healthcare worker experience also feel more better, and also reduce the time, and also it's reduce the error. Most of the error can be managed through the digital. That's what I can very happy to say that we were, even I am today assigned as a e-governance, as a, a coordinator for today for in AIIMS Delhi, because AIIMS Delhi is a leading institution in India. We have the tertiary hospital. The patient come from across the India. So it's a blood and bed strength also more, and patient flow is more. We can expect number of patients for visiting the outpatient and admission is more. It's very difficult to manage physically, and a lot of physical work, paperwork, that is very difficult for nurses today manage. So we are expecting that to do paperless work, and same time transparency and reduce the error, and again that kind of maintaining the confidentiality. These all also to be taken care. That's why, but still we are able to overcome, and that's overall outcome is to improve the clinical outcome. That's what our overall objective, patient care outcome. That also to achieve through these digital. That really it's the momentum is coming in our India, because it happened in the AIIMS Delhi means definitely the momentum will go to everywhere, because changes happening in public sector hospital, it is not easy, because we have a lot of resistant workflow changes, and again from financial capital, so many things, budgeting, so many things are always challenges to overcome, and again from changing the work culture of the nurses, doctors take time, but still it's happened at AIIMS Delhi today. That also is going to transform to every hospital, that really make the changes of the outcome of the patient. It is not only I'm talking about the changes happening in the services, and also changes happening in the nursing education also. So I want to just share two experience with you that today's session, because I always most important to what Dr. Chairman told, instead of talking with a slide topic, we have to share our thought and vision and experience that really make the student, the younger generation, to go further to improve, or maybe they can be better tomorrow with the take home as a message. So I had, when I was joined at AIIMS in Delhi, I was, I'm specialized in cardiac nursing, and I'm the educator, researcher, and different area. I'm working in, almost for 25 years. But when I joined at AIIMS Delhi, I understood one thing very clear with the concept. I mean, it's one thing I felt something with this patient, what they are suffering, and what especially the patient group, or maybe I can say the targeted patients are like patients who are with the end stage of diseases like heart failure, renal failure. The patient really come from different places where they get treatment from at AIIMS Delhi. Again, after that they go back to the home. It may be 300, 400, 1,000 kilometers far away from the home, from the hospitals. If something happened, because they are not sometimes end stage of disease, their drug compliance is poor. The reason is they are poor because of disease, they become poorest. And the reason is they are not able to spend money for the drugs. Sometimes they take medicine from AIIMS, but they complete the medicine, they will not buy medication, they spend the money for the family, because they may be the only the one to buy in the money, and it's for them it may be they maybe don't have money to buy the medicine. That is one problem. Another one, maybe they're depressed. Anyway, my life is over. I am the example heart failure patient from stage 3. This is the progress in nature of the disease. They become stage 3. They think that anyway I'm going to die. Why I have to spend money for me? So better that my family should be better. So this kind of problem patient is facing today, end stage of diseases. Otherwise they wait for transplantation. Sometimes they may not get organs, or maybe the donor for get the transplantation. Even if they get transplanted, again they go for drugs or immunosuppressive drugs post transplantation. This is a burden for them. That's why these kind of patients need to be followed up. That follow-up is, there is a gap that is always there, because once the patient discharged from AIIMS Delhi, we don't have a system of follow-up, what they are doing, who will monitor them, how to remotely monitor them. That is the biggest questions which it came in mind. And our Dr. Sandeep says is the number one physician, he's a cardiologist, and he's known with his vision and his work. He is my team, and we were all nurses in the team. We decided that we go for the one kind of the product, that is mobile app, which is be also part of the digital health. So we made this that 1 and 2, which help the patient to remotely monitor their parameter, because we have different parameter, cardiac parameter, ventilatory parameter, renal parameter. We have different parameters. Some parameters are core parameters that we wanted to look into, that whether they have kind of, problem, or maybe their symptoms are existing. Like patient with the edema, the weight gain is more. Patient have some arrhythmia, they may have the change in the heart rate or change in the ECG, or there is change. The patient may have, landed in cardiogenic shock, the BP is varied. So that all the parameter, core parameter, we want to look into that. That's why we made this app. That app is really worked out, and we tested with many number of patients, which proven that this app, continually we were able to monitor the BP and heart rate and the weight. They were every day, because that earlier we thought that how the patient may have mobile phone because they are very poor. So we are understood that after some time, everybody, whether they take food or not today, everyone have mobile and any Android phone. And there is today everyone we are able to access with somewhat some network, because every mobile data some kind of have kind of memories. I mean, which will be able to use it for their for their purpose of any reasons. So that's why we were tested before going into this type of work. We understood that, we did some kind of explore that, or be able to use this type of app. Then we understood, we realized that, we validated that. Then we went through this type of app with the help of collaboration of IIT Roorkee, because they also came forward to help us. Then finally we were able to that's because the nurse was one which is innovated with the collaboration of the cardiologist, and also with the collaboration of the IIT Roorkee, with the guidance and again mentored by Dr. Sandeep. So we were able to configure this app. And other than that, we also able to, they can able to share their any kind of investigation, because they are in Bihar. They cannot able to go to the doctor. They cannot able to get anything to be done for emergency. They can share that all kind of ECG, their X-ray, that also able to do that. This app really made the changes in the outcome. I told you that is especially readmission, especially for patients who wanted really the treatment and for accessible the healthcare but emergency. This all taken care by the heart failure nurses, because we have nurse-led heart failure management. We prepare the heart failure nurses. They use the app which were installed for the patient purpose. This is what the background of the development of the mobile app on heart failure, that really showed the outcome. And we also have trend also their example. Every day they enter their patients, their weight, the BP and the heart rate. If changes happen in between this from yesterday to today, any 10% changes happen in the rate, this parameter, the alarm will, message will come to the doctor, message will come to the nurse. We will also reinforce them to go to the doctor immediately nearby, or ask them to come to AIIMS. And we will also keep ready their, for the emergency to receive the patients, that type of, remotely monitoring and continuous, follow up. And again, we also able to understood that whether they are able to cope up the drugs and cope up the diseases, because coping up the disease, cope up the drugs is really challenging for end stage of the patients. And same thing happened with the cancer patients. Again, we understood that patient cancer pain also one of the challenges. They may not able to adapt the drugs. They may not able to they may also poor in drug compliance, especially taking analgesic or any kind of narcotic. And again, they have developed some complication due to palliative management, or maybe the drugs which are taking due to palliative a kind of cancer management. They developed a constipation, nausea, vomiting, so and poor adherence. Then we decided after this, success of this, which improved the outcome of the heart failure patient, I turn into this area in the cancer patient management, especially palliative management. And then we decided to went for develop the app. This is supported by ICMR. Initially, for first one, which is supported by IIT Roorkee, that I didn't get the fund that time. Still AIIMS to support in some parameter. But this time, with this, this improved the outcome of the patient. They, ICMR came forward and supported me. Then they brought this, they were supported with, provided the staff, provided so many technology, including this, from ignorance. So we have developed this app. This is for the palliative management, which we assured that, where we found some limitation in the previous app, like a issue with the, internet, patient not able to access because of the network problem, or patients not, taken medicine. There is no alarm for the last app. This time we made alarm. And again, these all made new changes. Patient itself, they can, drug complaints also we added with that. Every day they take the medicine, they will, press it. and with that how many dose they taken, when they get taken, because it's come down. So we developed as a e-prescription, because earlier we write in the paper, patient may not understand what type of drug. Now we made as a e-prescription. Along with this also, the patient can give the report on their pain level, either they have any worst pain or they have any symptom developed. These all report come to the doctors and come to our nurses and our team. We are able to help them. We also have web pages which is developed by AIIMS and along with ICMR. We entered all the medicine whenever the patient come. We are, because this is a app. Earlier one, it was in Google. It is available. You can download, but this one is it's a copyright. It's still with us. We are not able to. We are not giving to anyone who are patient registered in our in the trial, and we are. It's a password protected login ID and username. We are giving to the patients. The patient only can use it. Our family member can use it. Then they can all the time they can able to access this, and also they can enter, and we are able to follow up. And again, we are show that result already proven that they are improved in their compliance, their morbidity reduced, then pain is symptom is reduced, then they are really their quality of life overall this improved. That's a very difficult to achieve quality of life. That's why the technology, adapting the technology, use the technology the right manner, how that improve the patient care outcome, that what shown through these two mobile app, which is the practicing now made as a culture now today as used by all the patient. Now the government of India is also recognized our app for in the different way. So here also the patient, when the doctor don't have time to see everything, they will look only the map. That is how the add on the future of this app, how the patient pain was from yesterday to today, how is there any worst pain was happened. This is only this page is the doctor able to see. That also will help us and to doctor take correct decision, because clinical decision to manage the patient. This is happy to say that when the nurse innovate, that also today recognized by the government, and especially from the Prime Minister office, we are given that the national. Why I'm expressing to just motivate the young people, because always we are really passionate and compassionate, but sometimes you need motivation. That motivation also helps to move further, which really to this, because all nurses empowered, they for empower the community, empower the nation. That is our overall our achievement. So developing the digital capability is the nursing to ensure that all we keep pace with the digital evaluation of the healthcare sector, allowing them to reap the benefit of going digital, also enhancing the patient care. Thank you once again for giving me. I know I took more time.
Thank you, Dr. L. Gopi Chandran. To watch the complete club meeting on this topic, visit the link in the description below. Subscribe to the channel to get instant access to all the podcast episodes hosted by Innovation Curious. Follow us on social media through the links available in the description below. Thank you all for spending your time in listening to this week's podcast. Look out for a new episode every Wednesday, published on Google Podcast, Spotify, Apple Podcast, and YouTube. If you are interested in hosting your podcast with us, fill the form available in the description below. Thank you once again. See you next time.